My name is Tanya White, and I would like to talk about managing challenging patients in the community. But first, I would like to take a moment to acknowledge the traditional custodians of the land in which we gather, the Kulin Cultural Nation. We recognise their continued connection to the land and waters of this beautiful place. We respect elders past and present. Currently, I work in the community as a nurse, and at times this can be challenging. With some patients, we have a long time to build rapport, working with their current condition, and this helps when we notice changes in their condition, so we can alert the team and work towards helping in achieving the best care possible. Sometimes we are often called to houses to new patients, and we must build rapport very quickly. Some patients seem to respond to some nurses better than others. This project was created when I came upon a patient that was in bed all the time, with no want of hygiene or to go outside. He just found it easier to stay in bed, and looking at the care plans and notes from other nurses, all the notes would say that he was a challenging patient and he didn't want to have a shower and he didn't want to get up. So therefore, they would just leave him there unattended to and say he refused. However, over time, I got to build rapport with this patient and I managed to achieve getting him up and showering him. And so therefore, this is how my survey study began. And that was to find out why I could get this patient up, but other people weren't. And I wondered if there was some strategies that perhaps I was using that they weren't using that were actually the reason why. So I produced a survey and I went to my boss and asked for her guidance, and she accepted me during this project in the community. I spoke to a physio about the importance of getting patients up and their care. And then I went ahead and produced 4 questions. Very simple questions, but I thought all nurses could understand. So the questions were, how do you deal with challenging patients? And what strategies have you implemented in your practice? And how do you encourage patients to get up and mobilise? And what do you do if they refuse? So there were a few things that came about when considering a challenging patient, and they were every individual is different and they have their own sets of needs and challenges, and these need to be taken into account. We can't have judgment because everyone is different and everyone has their own sets of problems or issues or memories or anything that can attribute to their behaviour. We can't push our opinions on them. We can guide them. We can navigate through the challenges. We can encourage, but we can't force them to do things that they don't want to do. We need to explain our procedures whilst being there, and we need to listen to our patients all the time so they feel heard. And their needs are being met. So in response, the nurses came back with communication as being the best way of dealing with a patient. But failure to communicate with a patient and their level of understanding, not only from nurses but the team, can sometimes be a problem. So we need to understand the needs and concerns. We need to know how to set boundaries, and we need to ask for help if we need it in regards to dealing when the patient is being challenging. But we need to look at what else could this mean as well. And I think that's a very important thing. What else could this mean? Why is this patient being so challenging? And at the end of the day, patients remember how you make them feel. You've got to make them feel important and build that rapport in order to be able to assist when these challenging moments can occur. Now, there are various strategies that came back, and a lot of them were similar. De-escalation techniques. When the patient appears agitated or upset, we need to pause and take a step back and not take this on board if we can, because we can't project agitation back to the patient. We need to step back if we're feeling ourselves getting agitated and come back with a calmer mindset. We have to have patience with the patient when they're having these moments, because you cannot push a situation. You have to actually just look at it, breathe, try and de-escalate, find out what the real situation is here. We have to provide reassurance to them, and we have to support their feelings and their needs, because it's not about what we're feeling, it's about them. The focus is on them. And we have to make sure we're communicating in the best way that that patient actually understands what's going on, because sometimes it doesn't work for everyone the same way. Now, how do we encourage the movement when patients refuse to get up? Well, we've got to give some verbal encouragement. We've got to provide confidence and prompting. We have to provide necessary aids, and we have to stay with them to build that confidence. We've got to remove all false risks that occur in the community setting, because quite often in houses there's some that have just appeared over time, and have the necessary aids ready. We can't just say to someone, okay, you can get up, you've done all the exercises, we can do all this, you can do it, but there's no point if we don't have something that can enable them to achieve those goals. We also have to educate them on the importance of moving, and that's where the physio consultation actually came in handy, because if you don't use it, you lose it. That's basically what I was told, and so therefore we need to incorporate exercises, maybe some gentle massage, and some of the physio exercises always help in getting those limbs moving again. And also just having patience a little bit at a time. Some patients in the community are very ill with palliative care, and so therefore they don't have enough energy to move about. So you have to do baby steps, little bits, in order to try and achieve getting them mobilising. Now, strength-based nursing, I found there was 3 involved in my particular project. There's a collaborative partnership. We need to work as a collective team so we can incorporate that best practice to enable clients to reach their goals of a better life, including independence and confidence. And when we work through the care plans and communicate with peers and colleagues to what works and what doesn't work, we can achieve the best results, involving patients in their own care through encouragement. We can set goals together and determine the best plan of action that is right for that particular patient. Uniqueness. We need to understand every patient is different with their own set of needs, along with specific mental and physical capabilities. And when nurses understand their patients individually, they're better able to find effective solutions to problems affecting the patient and in the community. Often we have the time to adapt to their needs. And self-determination. We can't, as nurses, decide for others, but listen to patients, clarify, explain, suggest, and be an advocate for our patients and their families. Now, my objectives and milestones and evidence. There was an implementation of surveys that was achieved by way of the 4 questions that I mentioned earlier. They were simple and easy for them to elaborate on, and surveys came back in an allocated time, although they were staggered. Results appeared to have a similar outlook from the collective of nurses that were actually surveyed. Now, the issues involved were schedules of nurses proved to be timely dependent on their working hours, depending on the shifts they were on. Some people dropped out of the survey and they didn't even respond. So that was fair enough. Times at the moment have been incredibly challenging and tough. The survey proved to be smaller than first thought, and I found that to be quite upsetting, but easy to manage the results. And having to deal with a third party because these messages were relayed through my boss, so she got to see them, I found it was quite difficult because I had to deal with her every time I received a response. Now, if we look at the summary of the experience, now in the previous slides, I did answer the majority of the questions, but there were a couple of disturbing things that affected me when getting the survey back. So it was rewarding and it was great to actually communicate with my fellow peers and discuss techniques and see how they were managing and how they coped with challenging patients. And the answers over the collective were generally pretty similar. So in regards to de-escalation techniques, communication, stepping away, all that sort of thing. But what I found quite upsetting was that some of the nurses were really quick to jump to medication as a result. And that was from past history, past experiences that perhaps they had themselves been traumatized, that they jumped to medication within the first few minutes of an agitated patient. And some of those nurses actually had to walk away and they couldn't deal. They couldn't deal with an agitated or challenging patient. They just gave up and said, this is too hard, I don't want to do it, and walked away. And that I found quite upsetting too, because I felt that as a nurse, I've been in a number of challenging situations, and to this day, I have never walked away. That's not holding judgment on any other nurse. I can't say what works for me works for them, but I think we need to continue to form new strategies and work to assist these patients and de-escalate the situation and not give up. Because if we give up on our patients, who's going to look after them? And that is something that was brought to my mind from fellow nurses, and it's true. We can't give up. That's what we're there for. We're there to care, and we need to find out why this person is being challenging. What is behind it? And that's where I go back to that point of what is behind it? What is something else that we're not seeing here? And also, the other issue was not being able to follow nurses around the community, not being able to actually go in and see how they actually deal with challenging patients. Because in situations, sometimes if you're dealing with a challenging patient, if there's more than one person there, it doesn't get to that situation where it can escalate because there is someone else there. So then sometimes those patients can act a little bit differently. I look at it all. Communication is the key. Empathizing, learning about your patients, and finding interesting ways to incorporate into your practice things that will work, and sharing them with your peers. Assessing wounds in the community when you don't have all the equipment. You need to sometimes be very creative in how you deal with these situations because you are on your own. You might have someone you can call, but at the time, you tend to be on your own in the community. So if we can work together as a collaborative and continue to learn and communicate well with the whole team, including the physios and doctors, nutritionists, etc., I think that we can achieve better results. Thank you for listening.